I think cancer is a really scary word. And sometimes we try to put things in perspective from, yes, this is cancer by definition, but it's not one that we're going to recommend aggressive treatment for. And there are other times that we say, you know, this really is a serious diagnosis that we need to treat aggressively. And it may involve all three different kind of team members being actively involved. Prostate cancer is common among men in the United States. In fact, it's the most common non-skin cancer diagnosed in men in the United States. But if you look, there are over 3 million men who are alive today who've been diagnosed with prostate cancer, most of those who were treated. So it is a cancer that is very treatable. Prostate cancer tends to develop slowly in the vast majority of men who have prostate cancer. And so prostate cancer may be present undiagnosed and asymptomatic in a man for potentially many years before it gets to the point where it can be developed. But if left untreated, and if it is a prostate cancer that has more aggressive tendencies, certainly it can spread. And when we think of prostate cancer spreading, I think of it in three ways. It can continue to grow locally within the prostate until it breaks outside of the prostate and may extend into surrounding tissues. And that could include the bladder more commonly, into glands called the seminal vesicles, which are physically attached to the prostate, but they're separate from the prostate. It can spread via lymphatic vessels into lymph nodes. The last way that prostate cancer spreads is via the bloodstream. And that tends to occur late in the history of prostate cancer. Prostate cancer is definitely a cancer not of young adult males. About the youngest men that may have a diagnosis with prostate cancer are a very, very small percentage who may be in their early 40s. It certainly becomes more common in men as they proceed through their later 40s, more commonly in their 50s, 60s, 70s, and 80s. And so it's not something that tends to just decrease once you get to a certain age. PSA stands for prostatic specific antigen, and it's nothing more than a blood test that can be done for diagnosis of prostate cancer. And when I say diagnosis, you don't prove that somebody has cancer on the basis of the PSA, but at least it may help identify the man who has a higher PSA number, meaning we think you have a higher risk that you could have prostate cancer, and that could lead to additional evaluation, including perhaps a prostate biopsy, which is really the more definitive way to do that. I think the advice today that is recommended is discuss the pros and cons of PSA screening with your primary care provider. But because of the fact that prostate cancer really can be a fatal cancer diagnosis, and it can be highly, highly curable when treated at earlier stages, I still recommend that men strongly consider screening for prostate cancer. And the other thing that men try to avoid, but the other is just still having an examination of the prostate itself. If a doctor feels a lump that is suspicious in the prostate gland, those are rarely prostate cancers that we're going to ignore. And they usually need to be evaluated, staged, and usually those are cancers that require treatment. So although men get squeamish about it, I still encourage them to do it. So at a minimum, you want to make certain that you're doing a PSA test. I think since we started our multidisciplinary urology clinic, where we have the urologist, radiation oncologist, and medical oncologist seeing, potentially the patient may see all three of those physicians at the same office setting. We've seen a fairly significant increase in men coming for maybe second opinions, because they essentially can see 3 doctors if appropriate and get an opinion. Plus, we actually present those patients at a tumor board that is really geared for nothing more than patients with urologic cancers. You know, the purpose there is not necessarily just to try to convince the patient to have their treatment done at Nebraska Medicine, but it really is an opportunity to give patients peace of mind, give another overview, another set or group of eyes looking at their cancer diagnosis and treatment options. And a lot of times patient may just feel reassured that their original recommendations are consistent with what another group of physician specialists also feel, and it makes them feel that much more comfortable going forward.